Good morning. I'm John Woodrich, CEO of Bryan Medical Center, and welcome to our December 3rd briefing. And want to just continue to say to people, please mask up, please social distance, please continue to wash your hands. We've been talking about this for quite some time. And I know we've done a bigger push here in the last few weeks, and I think we're seeing some of the benefits of that. We've seen some easing up of our inpatient census, but still is extremely high. So we just want to encourage people, don't think that because you see the numbers coming down a little, we're in the clear, because we're not. We have to all continue to do our part. So we want to thank you for that, and also just thank the media for all the work that they've been continuing to do and getting the word out to people. So next week, we have Katie Packard, who's a PharmD here, who's also into research as a pharmacist and a professor. And she spoke here before to you, but she's going to give you a lot more information on our vaccine. So please look forward to that. I think that's the big question that we're hearing from a lot of people. When's it going to be available? How are you going to distribute it? What's the side effects? And I think Katie will give answers to a lot of those questions for you and for everybody out there. With that, I'd like to cover some numbers. Our positive COVID patients in-house, we're at 100. We still have 24 that are no longer positive but recovering. We have 8 of those individuals that are still on a ventilator, 17 in our intensive care unit, 20 in our progressive care unit, and 63 in our general care unit. You know, I think you need to not just look at Lancaster County here. You have to look at the number of patients that we take care of across the state. So our numbers remain high, but I think they remain high across the state. If you look overall, you still see a lot of people in the what we call the red dial zone. We've got to continue to be diligent. And we talk about all of these events that occur throughout our community, and that's the time for potential exposure. I know we're all still very concerned, you know, what happened last week during Thanksgiving, that we start to see those effects of that roughly about 2 weeks later. So as we look into the future, you know, we try to get people to abide by all the social distancing and masking and washing hands, but we know people still continue to get together. So we know we have other holidays coming up. You have Christmas, you have New Year's parties that people try to do. We want people to kind of back away from that and be as patient as they can. You know, you can even think of other events, Super Bowl parties that people have. Those are all things that we're looking at and saying, are we going to continue to see peaks occur during that time? And we can't stress it to you enough how our staff are pretty worn out from this. This has been going on for a long time. So we're still very concerned about these numbers. So when you see it go down a little bit, just don't think you're going to see a natural trend that it's going to continue to drop. I think we'll see other peaks occur over the next several months, and that's why getting this vaccine out as quickly as we can. And I think the thing that people need to think about in regards to this vaccine, now you're hearing a little bit more of it on the news, is that we're going to make sure that we get vaccinated, these healthcare providers and these clinicians, so they could continue to take care of people. And we don't know the exact number that we're going to get allocated to our community. We have started to hear some numbers that are going to be allocated to the state. But then we have plans as those allocations come into us, how we will administer it. So different people will be receiving this at different times. And there are side effects to some of this. So you also have to make sure that if there's a certain percentage of people that will have a side effect, such as fatigue or muscle ache or whatever it may be, that you can't administer it to like all of your nurses the same time, because there's going to be a percentage of them that may have to take a day or two off afterwards. Same thing with doctors and any other first responder in our community. So we have to be very careful. The logistics behind this is going to be quite complicated, and that's what everybody's working on right now. I will tell you there's a ton of work happening behind the scenes so that we could administer this as quickly as possible, but also as safely as possible to our staff, and as well as we work with our county health department and the other healthcare providers, how we take care of this community appropriately. You know, I think that's your own personal decision to do, but I would not do large family gatherings. I will tell you personally, I have a lot of family members that live in Omaha. We have had this conversation and said this just is not the right time to get together. I know it's a tradition that's hard to break for people, but you have to be safe. So the smaller you could keep the gathering, the better, and continuing to do those things. I know it's hard to mask with your family members sitting right next to you saying, well, I trust these people. But where have they been in the last week or two? Where would they might have been exposed to somebody? So you just have to be careful as you plan for the holidays. So we are using as much of our electronic media as we can, and we even provide for our patients tablets so they can go ahead and communicate with their loved ones. But without a doubt, this is tough, folks. I mean, to kind of limit the number of what we call support people or visitors, it's very hard. And we understand how difficult this is for families when we limit it to one visitor per day. But also, as we've stated in the past, when we come to end-of-life issues or somebody is very seriously ill, we make exceptions for that. But again, we're trying to keep this facility safe, our staff safe, our providers and the patients that come in our doors. But it's something that we have to do to protect everyone.